Hello, I'm Nick the nurse. When studying for the NCLEX exam or nursing school examinations, a lot of times questions come up that ask about what the patient or client's risk factors are for a particular disease or condition. One of the diseases that often comes up frequently on exams is aortic aneurysm. Now, an aortic aneurysm has a lot of different risk factors and causes. One of the really big things is arteriosclerosis and atherosclerosis. Can't say that right, never have been able to. But anyway, those are a hardening of the arteries as well as a filling of the arteries with plaque and buildup and stuff like that. Another cause of aortic aneurysm, or something that would put someone at risk for developing an aortic aneurysm, is infection. Smoking, which acts as a very potent vasoconstrictor, along with the nicotine, the active ingredient among many, in cigarettes, also can cause and put somebody at risk for an aortic aneurysm. Trauma is big, obviously, to the cardiothoracic area, around the chest and around the abdomen, can definitely also put somebody at risk for developing an aortic aneurysm, as can obesity. Obesity is definitely one of the prime risk factors for developing an aortic aneurysm. Syphillis, heredity. A lot of people who develop aortic aneurysms do so because it's hereditary. And what's really funny, I always thought about aneurysms, and when I taught nursing school, I would always go around to the students on the first day of class when we would teach cardio, and I would say, I bet I can guess who in this class has some type of aneurysm in their body, whether it's in the aorta or in the brain or wherever. Actually, all of us have aneurysms in our bodies to varying degrees. An aneurysm is simply a weak spot in a vessel wall, and when it's an aortic aneurysm, it can go very, very bad. Obviously, when you have pressure that's exerted against the weak spot in the vessel wall, which can lead to rupture and death, unfortunately. So the really big thing, really big risk factor and cause of an aortic aneurysm is hypertension or high blood pressure. Because like I said before, what happens is when you have an aortic aneurysm or at risk for one, and you have a weak vessel, what happens is when the blood is pumping through the arteries, what happens is if there's a weak spot here, the pressure is going to exert really badly on that spot. We don't want that to happen. So remember, and when we'll talk about this when we talk about interventions for aortic aneurysms in terms of the nursing process, you want to make sure that you keep hypertension low. So those are some of the risk factors and causes of somebody who might develop an aortic aneurysm. We hope you'll join us next time for the signs and symptoms of an aortic aneurysm, the nursing interventions for an aortic aneurysm, and the nursing diagnoses for an aortic aneurysm. Again, I'm Nick the nurse. Thank you for watching our video, and we'll see you next time.